Ali, you can get started.
Okay. Hi, good morning, everyone, and welcome to this webinar. Today's webinar is going to be addressed by Kristen Layton, and she is the director of Perkins India. So a few words about Kristen. Kristen Layton is the director of Perkins India, a program of Perkins School for the Blind. And prior to leading the team in India, she served as the director of strategy, innovation, and learning, and helped launch Perkins International's programs in the Middle East and North Africa. Before coming to Perkins in 2009, Kristen led the launch of the Inclusive Schools Network at the Education Development Center, Inc. She has held positions at Boston College, the University of Maryland, the National Deaf Blind Project, Helen Keller National Center, and as a special education teacher in New York. She holds degrees in elementary and special education. Welcome, everyone.
Thank you, Ali.
We have about, right now, about 25 participants as of now, and we have from many countries of the world. So welcome, everyone.
Yes. And Kristen, if you can share your screen, and it's all yours.
Okay, great. Let me just do that, and I'll share my screen, and then I will, oh, here it is. Sorry, I had it up, and then I will introduce, sorry about that. Let me just get, whoops, this is not the right screen that I wanted to share. It's this one. And, okay, can you see my screen?
Yes.
Okay.
Yes.
And we can hear you loud and clear. Great.
Wonderful. Thank you, everyone. Thank you for being on this webinar, and thank you so much to Vision Aid for hosting these webinars. I know that there was one that I really enjoyed on occupational therapy, and I know that there will be more. So I think it's wonderful, and especially thank you for including this topic on children with multiple disabilities and vision impairment. I have been in the field for about 30 years, so it's a field of study that's very close to my heart, and I think is so important for all of us. And really my goal today is just to share more holistically than clinically ideas and thoughts around working with this population of children. So thank you. I also want to have a shout out to Poran Dang, who is now, was honored as an incorporator for Perkins School for the Blind, which is a very honored position at the institution. So just congratulations on that. We're so happy to have you. So Perkins is excited about their partnership with Vision Aid. We've become friends over the past several months around the work in India. And I can share a little bit about the work that we're doing in India later on in the talk. Greetings from New York. The home of bagels, the Empire State Building, and coronavirus. So it is, of course, interesting times everywhere in the world, maybe especially here. But I am based in New York, well, right on the fringes of the city. However, as Ali mentioned, I work with Perkins, Perkins School for the Blind that you see in the photo on the left. Those of you who are not familiar, I know those of you who are joining us from from the US and the Boston area are familiar with the big tower. If nothing else, when you drive down the pike, you will see that tower from many places in the Boston area. Perkins School for the Blind is the oldest institution for people who are blind in the US. And as you'll see on the right, our biggest claim to fame is that Helen Keller was a student there. So Perkins has been around for a very long time. And one of the divisions of Perkins is Perkins International. Since the late 80s, Perkins has had an international program over the past 30 years, we've reached about over 70 countries we've worked in. And out of Perkins International came Perkins India. I know many of you work in India or are in India right now. So some of the examples and references I'll talk about as the current director of Perkins India will be from India. And we also, I'm not sure if any of our partners, we have many partners in India that just a quick shout out to Dr. Shroff's Eye Hospital, Jayati Baratum, our partners at Blind People's Association, Helen Keller, NAB, Sense International, we have, and many more. So if I didn't mention you, please know that we're just very proud of our partnerships all around India. So to jump into the topic, first I want to say, or just to mention, I had a very hard time picking and choosing what to talk about today. One, because obviously the idea of children with vision impairment and multiple disabilities, I have my entire graduate degree in this field. So there's a lot of information to cover. And also, again, we have such a mix of people that are joining the call, which is so exciting, a mix of people from different backgrounds, who live in different places, who have different experiences. So as I mentioned earlier, I really, the part of this I'm looking the most forward to is hearing back from you. When we're done with our 30 minutes, when I'm finished, sharing what I'll share, is I'm most excited to hear the questions or your thoughts about this population of children. So that's that's the thing I'm most excited about. So please, as we go along, think about anything that you'd like to know. And if we don't cover it here, I'll end with my email, and you can call me or WhatsApp me anytime. So who are children with MDVI? No surprise, MDVI essentially represents children who have a vision impairment and other disabilities. So that includes children who are considered deafblind, children who have cerebral palsy and also have maybe a cortical vision impairment. So it's a wide range of children. Over the past 30 years being in the field, I've worked with children who have gone on to get graduate degrees who have MDVI. And I've also seen children grow up who really do need a lot of support, even in their adult years. So one of the things that I'm hoping that everyone leaves with is perhaps maybe a broader view of the population and maybe a deeper understanding. I know many of you have experience in this area, and especially those of you who work at hospitals. I know those of you at children's hospitals see children with MDVI all the time. But I'll just share a little bit from my perspective. I'd also like to address the fact people say to me, MDVI, I never heard of that or whatever. And we laugh about it at Perkins all the time because we think we might have made it up. We're not quite sure. It's a real word. Of course, deafblindness is a global term that we talk about people who have a combined vision and hearing loss. MDVI was really the way that we think about including not just children who are deafblind, but those children, again, who might have a vision impairment and a physical disability, another disability that essentially compounds their challenges in learning and in being included in life. When I talk about MDVI and vision impairment, I always use instead of the plus, we can say vision impairment plus other disabilities, I always use times, because the idea of having a vision impairment and another disability has exponential impacts on a child. It's not just saying, oh, I have vision impairment, so I'm going to use strategies around vision therapy, and then the child has a hearing impairment, so I'm going to do things to address their hearing impairment, and then they'll be fine. It really is, it changes the game. for children because it's compounding and it's exponential. So I say that because it's probably the biggest, it's the largest reason really to think about these children differently and to really look at integrated therapy. I mean, that's nothing new. It's something we've been doing forever. But think about integrating the way that we teach these children and using strategies that are really targeted towards that multiplicative effect of MDVI. I'll throw a few facts and figures out at you because it's always nice to just have a sense. So Perkins estimates there's probably at least, and these are low estimates, 6 million children in the world who have a combined vision loss and other disabilities. And in India, over 1 million children, definitely. And the reason we have to estimate that is that these children specifically are not counted as children with a vision impairment and other disabilities. Even the Washington Group survey, as many of you are familiar with through the UN, World Health Organization, those counts, children are usually put into either a category of multiple disabilities or a category of vision impairment. And so we really do have to use figures like these, looking at prevalence. I'll start by saying there are not any wide studies that I'm familiar with anyway in all of these years that really give us a clear number of how many children or the prevalence of vision impairment amongst children with multiple disabilities or the prevalence of other disabilities in children with vision impairment. And we look at it both different ways. We do look at some numbers that we do have and from our own informal experiences over the years through Perkins School and our international program. So as you'll see some, which we also, you'll see Vision Aid, we have you in there because when we started talking about this several months ago in the president's office at Perkins, I was so happy when Ram and Ali went back and really talked to the people on the ground and looked at the data and found that 44 to 80% of the children that they were seeing with a vision impairment had another disability. So I talk about these statistics to kind of, raise the red flag and just make sure that, we spread the word and that everybody knows when a child comes in to a clinic, to a classroom, really anywhere, and they have a vision impairment or a suspected vision impairment or a blind, there's a very, very good chance that child has other underlying disabilities that may or may not be visible. So the reasons to, continue to dig deeper, to take note of any other disabilities and to refer them on is so important. Going to take a couple of minutes to share a very quick story. And I share this because for me, it encapsulates what's so important about understanding this population of people. This is a picture of a friend and a former student of mine, Martha. Martha is on the right. In this picture, Martha is in her she's probably close to 40. I met Martha a very long time ago, 30 years ago, a little less than 30 years ago, when I was a teacher at the Helen Keller National Center. So of course, this is a fast forward picture. Martha was about the same age as I was. She was in her early 20s. I was in my early 20s. And I was teaching independent living skills. On my desk that morning, I knew I was getting a new student, and I got a file on my desk. And the file had a big red flag on it. So I knew what that meant. It was kind of like the danger symbol. You have a student coming in, there's something to worry about. So I read the file, and there was essentially, Martha was a young woman who had very, very little usable vision, only really probably saw some light, had some light perception, and had no hearing. So she was a woman who was considered deafblind. Her family chose to keep her home because she had some very bad early experiences in school. So she didn't have a formal education. So she was sent to Helen Keller National Center for Rehabilitation to learn some skills. But she had a history. It was a long rap sheet of attacking teachers, biting, scratching, jumping on people, things like that. So my first lesson with her was making toast. And I had two big behavior specialists who were really more like bodyguards, looking over us to basically protect her and me. So that was my first meeting with Martha. I'm going to fast forward. 3 years later, Helen Keller is a short-term facility for people to stay and learn. So about 2.5, 3 years later, she was getting ready to leave, and I went to say goodbye and take her on a trip to buy some souvenirs. I knocked on her door. This is my last interaction with her. She opened the door. She said, "Hi, good morning. Thank you for coming to get me. We're going to drive in the car. We're going to go. But first, I want you to go to the nail salon because I want my nails to look nice and beautiful before I go home." That's what she signed to me. Martha was a different person. And why? Why? Because in the not that Helen Keller is such a magical place that we were able to do anything. It was communication. It was all about communication. Martha lived her first 23 years in a world of darkness and a world of silence. Not knowing what was going on around her, not, getting food, being very well taken care of by her family, as she will tell you later in life, but no way to say that she wanted water instead of milk, no way to say that she had to use the toilet, no way to say that she felt sick or tired or wanted someone to stop touching her. It was then in my very early career that I was so committed to this field. And I promised myself that every single child or person that I ever worked with, that I would think about Martha and think about the possibilities. Is this child able to access the information that they need to really grow to their full potential? Is this child's vision not allowing them to really take advantage of all the incidental learning that's out there in the world? Is this child not able to communicate and therefore hitting and scratching and biting because they just want someone to understand how they feel or what they need? So I hope that, I'm sure many of you have your own Marthas. Many of you have and know students and children who have similar stories. If not, you're welcome to share Martha with me and to think about her when you work with children. So how can we, thinking about, the very basics and talking about identifying children who have needs for the sole purpose of addressing those needs. And in the case of Martha, had her needs been addressed earlier, her life would have been very different. I forgot to mention, I will go back. Martha, in that photo, she went on to move back. She went on to actually move to Texas. She was from New York. She moved to Texas. She got married, and she, as last I heard, was probably about 8 years ago, she had a job as a file clerk at, I believe it was like a rehabilitation center. So she used Braille labels and she was able to file and do things. I'm sure now she's probably moved on to computer work. So what I'm sharing with you is something that we use in our international work. This was specifically around our work in India. And we just call it a journey map. It's nothing new. It's something that's used in marketing. And I'm sure, Ram, I'm sure you're familiar with these kind of things. And essentially what we do in order to make sure we're targeting our audience, who's children who are deafblind, is to look at what their journey is and where things work and where they don't work. So through our work in India, and we've worked in India for about 30 years, so our team knows a lot of children and a lot of success stories and a lot of children who haven't gotten the services they need, just the same as anywhere else. And we put together this journey map. So, in a perfect world, and in a place where a child's really able to grow to their full potential, we look at the fact that they would be identified as having, possibly a vision impairment, a hearing impairment, maybe, what do they call it, newborn hearing screening, right at birth or close thereafter. That would lead then to some early assessment, identification, and that they would be referred to the places that would be able to address their needs, and hopefully in a comprehensive way. They would receive some early intervention, which would typically, be working with the families and, helping to empower the family to be able to work with the child, involving the family, some early educational experiences, some before school so that they're really ready to go. In there somewhere, they're getting their medical disability certificate, which of course we know in India is a very important thing to have for families, that they can get certain services and things that they need. And then eventually that they're part of the education system and supported there. So when we meet new families, and when we've been actually doing a lot of landscape analysis for our new project that I'll talk a little bit about later, we looked at a lot of kids. I'm going to share with you, I didn't share a picture or anything because for privacy. Some of you may know some of these children. So we looked at a little girl, I'll call her Priya, and looked at her. She was born not in a hospital. She was born in a village outside of Lucknow. And so she didn't receive any kind of early screening, or anything. So it wasn't until she was probably, I'm just looking at my notes. She was about, her mom says about 9 months to a year, where they really started to recognize that she wasn't developing like her brothers and sisters. So she really, missed those first early few months. But the parents didn't know really what to do. They didn't know what was wrong, and they didn't really have access to any resources or anyone who really understood. And they were actually a bit ashamed. They didn't know what they should do with their daughter. So they kept her home. So she actually missed the next milestone too. She didn't get any early assessment. She wasn't identified. She wasn't referred anywhere. So she missed the third. There was no intervention early on in her life. Thanks to our local partner on the ground, Priya was found. It was really a local connection. Somebody from her village found somebody from our partner organization and reached out. So the family did get involved. They loved their daughter. They really wanted the best for her, but they didn't even know that there were services. So finally, when she was about 9 years old, the family met our partner and started getting some home services. Our partner also was able to get her a medical disability certificate, which really benefited the family with some financial support that they really needed and some other services, including a wheelchair. Because there was a school close by, but she had cerebral palsy and cortical vision impairment and wasn't even able to get to the school. The local partner supported the family in advocating, going to the school and saying, we have a child. The school was open enough to accept her with the new wheelchair and everything, is that she finally did make it to school, which in the end, in some ways is a success story. She's doing wonderfully. She's doing great. She's going to school not every day because she doesn't have someone to push her wheelchair there every day. There are some challenges in some more rural areas, but she is more included. Her parents are working with things at home. We are sending pre-COVID-19, sending teachers to her house. But again, all of the milestones at the beginning, the newborn screening, the early intervention, she missed a lot of those opportunities to really be at the place where her peers are. And she's a smart little girl, and she could have been there had all of these things happened earlier. So one of the most some of just the very basic things when we're thinking about screening, assessment, and identification, and the ways that we approach this in places that we work all over the world is that the three things that are important, and these are, I know, very basic as far as those of you who work in the vision field, you know, who understand this, but screening, meaning that people in the local community, people that children are going to be come in contact with early in life, understand some of the signs. They don't have to be vision professionals. They don't have to really know a great deal about the eye, about disabilities, but they need to understand that if I meet a child and instead of looking at me straight on, they look at me like this, or maybe their eyes are, you know, have peculiar movements that I haven't seen before. These things that raise a red flag, and that those parents, professionals in India, I know we're doing training with ASHA and Anganwadi workers, not so that they're experts in the field, but that's so that they recognize some of the signs of vision impairment and other disabilities, and they're able to refer them on for further testing. The second piece, and this is many of you, you know, all of you who are in the vision field and who work at eye hospitals and in different capacity there, is the comprehensive collaborative vision assessment. And this is one of the, you know, this is one of the areas that is super important, because in our experiences, and I know in your experiences, and I'm preaching to the choir here as well, is that traditional eye exams, traditional screenings are typically not going to work for all children with multiple disabilities and vision impairment. So thinking about how we can test these children, get accurate assessments across the board. And we'll talk a little bit about that more later. And I'd also like to add is that my colleague, Dr. Barry Cran, who some of you know, who runs the vision clinic at Perkins School for the Blind. He also works with Children's Hospital and then New England, the College for Optometry. So he will be doing a future webinar. And he is certainly the expert on vision assessment for these children. So I tweaked my presentation a bit when I found out he was going to come after me. He's a much better person to learn that from. So there's a plug for his upcoming presentation. But the third most important piece is that also the referral piece, that the people that are doing the comprehensive vision assessments and the overall comprehensive educational assessments, that they have the connections and just the knowledge of where the children and families need to go to get interventions for the other disabilities that they may present with. And hence the reason for documenting that not only does a child have a vision impairment, but has other disabilities, but also having that next step for children in all those cases. Some of the challenges that, again, I'm sure you all share, but that we've certainly seen, and really that are highlighted. If anyone's really interested in this, I can also share. We were recently in a joint project with Orbis International, Sight Savers, Standard Chartered Bank, Helen Keller International in China. It was a big 5-year project, and through that project they screened over 1 million children for vision impairment in schools. Perkins International was brought in to essentially address the needs of those children who are identified with MDVI. So those children who are identified with a vision impairment and multiple disabilities. And it was a very interesting project because we just, you know, we did some training, we did things, but we kind of sat and waited, and we kept kind of raising our hand saying, you know, can you give us the list of the kids that have the additional disabilities? And well, there are none. And now this was early on, they hadn't screened 1 million yet, but there are none. And we kept hearing, no, there are none. And so very early on, we caught on. We said, you know, what we know about prevalence of vision and other disabilities with vision impairment, we know that there certainly are. So what we had to, so eventually what we did is that we we started looking at the assessments that the doctors were doing in the schools and at the clinics, and we would see, you know, the children listed, and then there was always the line, cannot test, cannot test, cannot test, cannot test, cannot test. So of course, unveiling all that and going back, what we found is that that there just wasn't the knowledge and skill of the people that were doing the screening to really accurately test those children who were presenting with other disabilities. Using some of the things that all of you know, some of the LEA symbols, some of the functional vision assessment tools, and really using a comprehensive assessment in order to assess these children. The good news is we were able to quickly jump in, and the medical professionals were willing to come out with us to these sites and do a comprehensive assessment with an educator there, looking at the child's functional vision at home with the families, what are they seeing, some of the interviews, and a lot of what we know about functional vision assessment. And as I mentioned, Dr. Barry Cran will get into some of those examples. I'm showing here again, and I just realized that we're at 30 minutes. I'm just going to take a couple of more minutes to just make a few extra points, if that's okay. Here's a picture. On the right is one of the ophthalmic paramedics from Dr. Schroff's eye hospital. So a shout out to you there at one of our vision. At one of their vision screening events. And as you can see, you know, the vision tech is using sign language with a child who also has a hearing impairment. Some of the vision, some of the more functional vision, pictures of functional vision assessment, talking with the parent, really understanding what the child's seeing and not seeing, documenting that. And then also, you know, as part of their educational assessment, really looking at what their vision is, what they can see. My next slide is a video of a functional vision assessment. I'm going to, again, just save that for Dr. Barry Cran, and because he has some great footage. If we had time, I was going to just kind of walk through that with you. But what I will just quickly talk about, and this will hopefully lead us into our discussion, is integrated approach towards achieving educational access. To me, in many ways, this picture says it all. And that's why there are no words. There are no words that are needed on this picture. This is the accumulation of almost everything good about integrating education and assessment and really looking at a comprehensive approach for children who have vision impairment. In this picture, you see a mom at home with a child who has vision impairment. She's obviously working on the child's vision. She has contrasting items, but they're functional items, and she's actually taking things that she has in the house and sorting them, probably for a very good purpose. She's putting the tomatoes in one, and looking at different ways to sort. She's labeling the items so that the child is also taking in pre-literacy skills, communication skills. The mom's using hand under hand to help the child with her, you know, with her physical movements to be able to reach. And so right here, the mom is really working on vision, but working on so much more with that child that will really help her to integrate her learning to be able to do functional things in her home. If you invite me back, I'm happy. I have a lot of just great examples of kids. Again, they're not perfect examples. I'm going to skip talking about our Project IDI, just to let you know it's happening in India. We're working in Uttar Pradesh on identification and getting kids identified and really ready for school intervention. I have to do a shout out to our partner, Dr. Schroff's Charity Eye Hospital, which is one of our main partners in there. They've been amazing to work with, and now VisionAid is working with them as well. in the location where we're partnering with them in Vrindavan, they've actually opened up an early intervention center. So the children that we do identify through our project will get the services they need right there. So it's really an incredible partnership. I'm not gonna go through this. I have to, in closing, this is my friend and colleague, Maricar Marquez. She's at the left. This is at the United Nations. A few years ago, we did a talk there. And Maricar is a woman who is deafblind. She has no vision. I shouldn't say, she can see like shadows and she has some light perception. And she has no hearing. She's a woman who's deafblind. She has her graduate degree. I've run marathons with her, done triathlons with her. She's climbed mountains, jumped out of airplanes. She's an incredible woman. I'm going to close with reading to you what she said at this event that I will never forget. She was talking about her experiences as a person who's deafblind and how the advantages that she's had have made a difference. These are her words. I think about my success, and from education to employment, when I think about that for myself as a person, I think that my perspective is different because of who I am. And I think it's others' views of me, realizing that I could attain what I have as a working and now married adult. I'm a very different person than anyone thought when I was younger, and had I not gotten the services that I did, I wouldn't be where I am. So when you talk about equity, it's regardless of the fact that I can't see or hear. It's about the services I got and the people that I met that looked at me and thought that I was just like everyone else. And we need to raise that bar for all children. So I end with that, and I hope that, I'm sorry I went over with my presentation, and I hope that there's time for some questions. Thank you so much for listening to me for longer than you planned.
Thank you, Kristen. It was really a wonderful talk, very educational talk, very inspiring and very educational talk. I am a little bit more wiser with these talks now. So we open this up for questions. So Ram, do you want to say something?
Yes, that was an excellent presentation. Thank you so much, Kristen. So I'm looking at the chat. Don't see a whole lot of questions on the chat. I don't see raised hands. So maybe at this point, since we have about 15 minutes left, we can just open up the lines. Does that sound okay?
Okay, so I'm muting all of people.
Yeah, I would request.
Can you put my picture on, Ram, Turundan?
Yes.
Yes, 1 second.
And I want to say a couple of words.
Please,
Sure.
go ahead.
I enjoyed your talk very much because I feel that cases like this, MDVI and other blindness and disabilities, example is the best thing to do. And your presentation from that point of view is very
Puranji, you have to start your video if you want to see.
very educative. Thank you.
Thank you so much.
Thank you so much, Puranji. Anyone else is welcome to speak, comment or question, but I would request that those who are not speaking to please mute yourselves so that the call quality is improved. Thank you, Puranji. That was an excellent comment.
Thank you.
Yeah, welcome anyone else. It's open for anyone for comments or questions.
Kristen, this is Lubina. I was very impressed. It was very informative and very engaging. So thank you very much. I guess my question is really more from curiosity, from an occupational therapy perspective. How involved are occupational therapists in India, from your knowledge, in serving children with MDVI?
Yeah, that's a great question. And I've been working in India as the director of India for only a year. So I can't say that I've been everywhere and seen everything. So I just want to start by saying that. In some places, I've seen a very comprehensive approach, including occupational therapists, including physical therapists, really the whole team coming together. You know, in many schools, specifically those schools that have been working with children with multiple disabilities for a long period of time. So they, so in those places, in places where this is, you know, there are a lot of places also that children with multiple disabilities aren't going to school. And I should have started out saying that about 90% of children across the globe who have MDVI are not in schools. So, and access to those professionals is limited in many ways. But there is, you know, there are very strong examples in India where the collaborative team is really coming together, including occupational therapists. Because how important it is. You saw with, I just forgot what I called her. I made up a name for I'll call her Cindy now because I can't think of what I called her to save her privacy. But as you can see, we were working on occupational therapy goals in those sessions, as well as vision therapy. We were working on physical therapy. We were working a lot on communication. Those being some of the most important things for those children.
Thank you, Kristen. We have a question over the chat. This is from Deepak. And I believe Deepak is from the LV Prasad Eye Institute. So Deepak, you're free to articulate your question, but I will read it out as well. How do we ensure the safety of the therapist and the children during COVID-19? Is there any protocol developed by Perkins International for this?
That's such a good question. Interestingly, the magazine, some of you may be familiar with, The New Yorker, I think it's published worldwide, did an article this week on the impact of COVID-19 on people who are deafblind. So of course, we in the field were shocked that a big publication did this article. Actually, the woman Marikar, who you just saw, who I read the quote about, she's featured in the article, actually. But to answer your question, it's very, very difficult because, as we know, children with multiple disabilities and vision impairment rely mostly on? Their tactile, their ability to use touch, to get information, to communicate with other people. And so it's a big challenge. One thing Perkins International we're doing is if you go to the Perkins India website, you'll find we're doing some videos for parents on hand washing. How can you get your child with multiple disabilities, even if they have physical disabilities, involved in hand washing, keeping a clean home, hygiene, things like that. But it is difficult. What we're doing at Perkins School is, as you know, the schools are closed in Boston. Our teachers are amazing. They're working every single day doing sessions with the children and their families at home, which I know schools all over the world are doing. So I hope that answers your question, but it's very, I do know some other places in the world. We work with some orphanages, and some of those staff had to shelter in with those children with multiple disabilities because the risk was too high having them come and go every day. So these children are some of the most vulnerable during these times.
Thank you, Kristen. Yeah, Deepak just sent a note that he's having some mic issues, but he sent a thank you over the chat. I see a question from Saranya. Saranya, is your mic working? Would you like to ask?
Yeah. Exactly the same question I thought of asking, sir. I'm just curious about the community reaching. So this is challenging area for us to like moving the people from the rural areas to get comprehensive services which are easily availed by the urban population. So we're trying our best to expand our services to the rural parts through community workers and community-based rehabilitation programs. So I just want to know about the work of Perkins India in that.
Yeah, thank you. The communication was a little garbled. I think the connection wasn't good, but I think I got what you said about our work with in the rural community. Yes, very challenging everywhere in the world. So really the key to what we've been doing so far, I'm just flipping, I don't know if you can still see my screen, but our project IDI, so what we've really been working on is working with community-based workers, training those community-based workers at local NGOs. And we're essentially trying everything. We're doing, we're accompanying eye hospitals to their screening camps. We're going on our own to certain schools doing screening camps. We're going door to door. Outside of Lucknow, we've visited in 5 months 113 villages. And through those, we've screened 430 children. We found that the door-to-door screenings, going to the village, the head of the village, and the Asha and Anganwadi workers, asking them, you know, do you know, is there a family in the village who might have a child with disabilities? And then our community workers are knocking on those doors and then meeting the children and doing an initial quick screening and then getting permission from the family to do a more comprehensive vision and overall assessment. Out of those 430 children, we've so far identified 103 with MDVI. And as you can see on the screen, you know, just at the eye hospitals, it's less of a percentage because some children just have a vision impairment, but at the disability screening camps, we're really finding a lot of kids that have multiple disabilities, vision impairment. And I'm happy to, you know, any additional information, I'm happy offline. I shared my email before, I'll share it again, so please reach out anytime.
Yeah, please. Especially we want to know about the working area, so we can refer our patients to from the north part of India. We find it very challenging to find a suitable center for the children, particularly from North India. In South, it's far better to reach centers. So I will be interested to get those areas of yours where you people are working, so you can refer our kids who are coming for vision assessment and coming to the gym.
Certainly, please reach out, and I'd love to have the conversation. Part of our project, I just want to be clear, is identifying children, but also connecting them to services. So if services are there might be like a school that will accept children. We'll go in and provide training for that school so that they can address. If not, what we're starting to do is create, like, really in small villages, these small community-based, like at the Anganwadi centers, even if it's like once every few weeks, that a teacher goes there, meets with a small group of families. So we're doing whatever we can.
Yeah, sure. Thank you so much.
Thank you, Kristen. And just to introduce Saranya, the person who just asked the question, she's the head of the Vision Rehabilitation Center, Resource Center we set up in Chennai. And I think your team members, Paige and Supriya, met with her.
Oh, yes, of course. I'm sorry, I missed you. I had to.
It's okay.
Yeah, she works for Sankara Netralaya in Chennai. So just to make a connection there. Yeah.
Great.
Do we have any other questions? I'm just again looking. I see a question.
There is one more from Deepak as well.
Go ahead, Ali.
So Deepak is asking one more question. This is, how about tele-rehabilitation and use of technology for providing speech therapy? Physiotherapy and care by multidisciplinary team has become challenge and concern during this time. Your comments?
Yeah. I couldn't agree more. The teletherapy, you know, it's somewhat of a solution, but it's not a perfect solution. It really isn't, because as we know, especially children with multiple disabilities, those children with cognitive disabilities, you know, they're not able to follow a therapist on the screen. So then the parent, you know, of course, take on the role of being the teacher. And so the dynamics have changed. And then will the child react the same to the parent? There are many challenges. I know at Perkins we're doing everything that we can to get, I'm just going to share this quick like story. There was a teacher who was saying that this one child would not get on the screen with her at Perkins. So she was connecting with the family, but the child would not look at her, didn't want to see her on the screen, or I don't know if the child was scared. So instead of saying, we're going to meet your teacher and do teleteaching, the teacher said, well, my dog wants to meet your dog. And they did like a meeting of the dogs, of the pets, on the screen. And it got the child. So the teachers have been really creative. So it basically took the fear factor away. So then the teacher used that moment where the two pets were like on the screen together to get the child to do some interaction. I'm not saying that like that's my brilliant solution, but those are some of the things that we're just using, like really anything to get the child to be able to interact if they can with the therapist on the screen, but if not, family or siblings to be able to do that.
Yeah, and in fact, Kristen, excellent answer. And if with your permission, I'd like to invite Lubaina, because Lubaina is an occupational therapist and she has been spending all her days working with children remotely. So Lubaina, if you could say a few words about this.
Sure. So, I work in a public school setting, Kristen. And while I don't currently have children with specific visual impairment on my caseload, I can tell you, I'm working with a 3 to 6 year old population and providing therapy remotely. It's not my area of expertise. I'm a very hands-on person. So I've had to do a lot of learning, but the role of the parent, because I work with children with significant level of challenges such as autism, and for the parent to have the child sit in on a session, they're just grappling with trying to keep the child seated. So really, most of our teletherapy training with this young population with many challenging disabilities has been via the caregiver. We send home things that are functional, that are activities and materials that they have in the house. That vegetable sorting slide that you put up was definitely the key. So we come up with ideas based on what we know they have in the house, whether it's toys or it's, clothes, where it's vegetables, food, and create activities around those objects that the parents can use to interact with their children and achieve goals. I have on this call my niece, Neha Sharma, is a speech and language pathologist at actually Perkins in Waltham, Watertown. So I know she's on the call, and I'm going to refer to her to talk about some of her challenges, because I know she's pulling her hair out trying to provide teleservices for many of her students who are MDVI. That's the population she works with. So we have a ground worker aboard. So Neha.
Hello.
Hi, Neha.
Hi. Yeah, so I'm actually at the deafblind program working with these students firsthand, and we are struggling because so many of our kids learn through touch and exposure and experiences with their multisensory programs, and it's been challenging. We are working with the families and caregivers, trying to support them and provide consultative services. We do video or phone calls with those family members. We're providing activities and very simple, clear tasks that they can do at home. And it's challenging because our kids also have many behaviors that need more attention than some of the actual therapeutic services that they're getting from speech, PT, and OT. So we are working as best as we can, but it's a definite challenging time for our students.
Yeah. So exactly. And I know that I've been connected with a lot of, the teachers from the deafblind program and know that it's been challenging. So that's why the dog story really stuck out, because I just thought it was just so clever as to a way to really break the break the tension for the one student. But thank you. It's incredible what you're all doing over at the school.
Yeah, and great set of questions. We can continue a little longer. We are at the hour. So before people drop off, I did have a couple of announcements. And then, Kristen, if you don't mind staying back a few more minutes, we can continue the discussion with anyone who needs.
Sure.
But if you can just let me share the screen, I just want to mention a couple of, I think you need to stop sharing your screen.
Oh, sure, I will do that.
And I will just bring up my screen and just mention to people who did not register directly that you know, we have a couple of upcoming sessions. I'll just give you a preview of the upcoming sessions. So all the information will be posted on this page, which is a training.visionary.org/events. You should have received this by email as well. Please go ahead and register if you haven't already. And on this page, you will find the talks as well as the recordings. The recording for the last talk is already posted. We will also post Kristen's recording here, which you can view later or share it with others if you want. And we haven't posted it yet, but we already know the next two talks. Next Wednesday, May 7th at 7:30 a.m., same time as this one, we are having Dr. Bhavani Iyer. She is a faculty member at the University of Texas, a practicing low vision specialist, and she will be talking to us about the latest advances in low vision devices and technology. So that will be an exciting talk. The week after that, we have Dr. Barry Tran, who is the optometric director at the NECO, New England College of Optometry Center for Eye Care, and Kristen referenced him. He also does a lot of work with Perkins. He'll be talking about cortical vision impairment, visual impairment. That's May 14th, and please look out for the time. So I just wanted to throw those out there, and a few more talks are in the process, so just keep a lookout on that page, as well as your emails. We'll send the details to anyone who registered. So with that said, just want to go back, anyone who has further questions, we are happy to stay back maybe another 5 or 10 minutes and continue the discussion.
There was one question which we received, and well, that's an observation and a question. There's schools in India still do not have inclusive classes, and there are special schools. So what can and should India do to create inclusive classrooms?
Yes. We know as many of the, there are laws in place in India, as many of you know, that schools should include all children. It just doesn't happen all the time. For us and for the kids with multiple disabilities, we have done everything from working with the families to have them advocate. The story I was sharing with the journey map of Priya, really, we just took a chance with there was only one school option that was even remotely close by, and just went there with the teacher, with our partner, with professionals, and said, we can make this happen for her. Like, she should be a part of this classroom. And the teacher said yes. So sometimes, it's about the local advocacy. It's also about training. People are fearful of what they don't know. So a school administrator, I actually had a school, not just once, over my career, I've had many. I went to a school for the blind with a child with who was blind, who had a hearing impairment as well. And the principal looked at me and said, well, we don't take those children with other disabilities because they can't learn. And unfortunately, there are a lot of people that believe that, that they believe that the issues are too complicated. So it's really the education also of professionals. We've been working for a long time providing teaching, at universities in India, at special schools, training staff on how to make it work, showing them, working with students like the girl that I showed you, who really has, significant challenges in communicating and everything, and showing them, well, yeah, she can say more. She can actually tell us that she wants more, and having them believe that these children can learn. So I wish that there was a magic answer to that. It's really about advocacy, and it's about making people believe that, or showing people that these children can learn and can be valued members of the community.
Thank you so much for the answer. This was a question from our program manager in India, Anshuman Agrawal.
Oh, great. Thank you for the question. And again, I would love to talk more with anyone who wants to email me. So please do.
Any other questions or comments before we close?
This was an incredible presentation. You know, I could have heard more from you, Kristen. Thank you. It was an eye-opening presentation on what is possible.
Yes, well said, Revati. Yeah, I echo that, and thank you so much, Kristen. Great talk. We appreciated having you on the session today, and I'm sure we'll continue staying in touch.
Of course. Thank you so much. Please for having me, and anyone reach out, and and please listen to Dr. Barry Cran as well as all of the webinars, please. But he'll be wonderful as well. So thank you. Wishing all of you well, and stay safe and healthy.
Thank you.